Hello, my name is Eli Moses. I practice in northern New Jersey in Fairfield. I'm at Corneal Associates of New Jersey.
Great. And Dr. Moses, I know that your practice is using the Avellino test. Can you talk a little bit about how you incorporate the test into your practice?
Sure. So all our new patients that we see get an extensive history, both family and non-family history. This is most important with patients who have laser vision correction or being evaluated for refractive surgery. In our practice, we're especially concerned about that because we want to rule out any genetic or heritable diseases when we're thinking about laser vision correction. So we use the test primarily in certain scenarios when we have patients who are more typically high risk, so patients of Korean or Japanese descent, which have about a 1 in 1,000 prevalence. We will test those patients, or at least advise them before laser vision correction. We also, anyone who we see stromal opacities, if we can't explain them, we won't say something like contact lens related. We need to actually have a source as to why they have the opacities before proceeding with laser vision correction. Finally, anyone with a family history of a dystrophy or a corneal surgery, a penetrating keratoplasty with an unknown reason, those are the ones that we investigate further as to why that is and recommend testing.
So actually, what are the AAO preferred practice guidelines for using available genetic tests?
So the AAO set out a task force in 2014 to look at when to test for genetic diseases. It was kind of involved, but the overall summary is basically when you get genetic testing, you want to make sure you're sending to a CLIA certified laboratory to ensure the proper handling of the material. The second thing that's important is making sure that these are Mendelian traits. So we don't want to be testing things that we have no positive outcome if we have a positive result. So these would be things like corneal dystrophies as opposed to macular degeneration or open-angle glaucoma that are multifactorial, and the genetic testing wouldn't necessarily guide us in a proper way. They also want to make sure you're testing things that have a purpose. So people who have known genetic disease but there's no treatment, specifically kids, those are recommended against testing because there's no ultimate benefit of that test. And finally, it's important to make sure that we give these patients the results of our tests, especially if they're positive, so that when there's gene therapy available, hopefully in the near future, they know where to target those studies and their treatment patterns.
And how is the Avellino test performed, and how do your patients react to it?
Sure. It's a pretty simple test. It's very safe. A kit will be sent which has a buccal swab, just like a typical DNA test. You'd swab about 10 times up and down on the inside of the cheek. You would then put that in the provided plastic tubing that's given and sent out. There's no special preservatives or material that's given. You would send that directly to the lab at that point where they would study it and do DNA PCR testing.